Okay. So I want you to answer this question, right?
Okay.
The same way you answered it yesterday, and I'm also going to like walk you through the thinking process, right? So I want to see
Okay.
how
Do
you
you
answered
mind
it.
making it a little bit bigger? Because I have problem with my eyes on the screen.
All right, no problem. Let me know when
Okay.
it's okay for you.
Okay.
Is it
That's
good that you
fine.
okay?
That's fine. Yeah.
All right.
Okay. The nurse is teaching a client who is receiving newly prescribed clopidogrel. Which of the following information should the nurse include? So I understood on the body that the nurse is conducting a teaching about certain medication,
Mm.
and this is the medication. So which of the following information should the nurse include? So the information that the nurse has to give the patient about this medication. So option one, notify your primary healthcare provider if you experience unusual bruising. So I chose this answer because I was thinking, I assumed, let me assume I don't know what medication it's for. And then I went to option two. I said, oh, over the counter medication Tylenol cannot contraindicate with so far with anything. So I just canceled that. And then option three, I said, avoid driving your car for a short time until your response to the medication is known. So I would say not avoid, at least if it's something that can cause life risk like dizziness or can cause any harm. That's when we tell them to stop driving for a certain period of time. So I canceled this. And then have a blood specimen obtained every 3 months to check your serum albumin level. So I was thinking this is not about albumin. So I know this blood work is not for that type of medication. That's why I went with option one.
Okay. That's brilliant, right? You did a great job with your breaking down. Right now, let me add more clear understanding to what the examiner is testing. Now,
Mm-hmm.
remember I said NCLEX have what they call eight client needs, right? These
Yes.
are your session, right? Now, this session are what we call management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, reduction of risk, pharmacology, and physiological adaptation. Now, the reason why we have these eight different categories because the way you are going to answer questions related to management of care,
Mm-hmm.
NCLEX are already provided a certain content and a certain way of thinking through it. Same with safety and infection control. The way you are going to answer physiological adaptation is different from the way you are going to answer safety and infection control. Now, under safety and infection control, you can have a disease, which is an infection, and under physiological adaptation, you can have a disease. They are both disease, but when you are going to answer the one related to safety and infection control, your main goal is to prevent the infection, is to control the infection, right? But
Mm-hmm.
for physiological adaptation, the disease, your main goal is to either treat or manage it. That is the difference between the both disease, but in different categories. So this is the reason why I tell students know how to think like the exam. Because the moment you can think like the exam, you can see a particular question and start using that thinking process. Now, this particular question fall under the category pharmacology, right? Now, since we know this particular question fall under the category pharmacology, the next thing we want to know is what the NCLEX want to test related to the pharmacology content, because NCLEX has already provided the information. So now all I just need to do is to understand the three parts to the question, which you've done perfectly well. The body of the question, the stem, and then the answer keys. Now, since I can understand that process, then my answer key, I need to break it down according to the understanding of what the NCLEX want to test me so that I can start answering accordingly to the main purpose of the question, which is teaching the client about the prescribed medication. Now, we understand the body of your question, which is this, right? That's where you get the content. So the content is all about pharmacology and it's testing what? The concept, teaching, and learning, which is this right here. So you're about to teach a client, right, who's receiving the prescribed clopidogrel, right? So that is just the information. So what is the examiner asking me related to that information? So this is the real question right now, which is the stem. So the examiner is asking which of the following information should the nurse include. Now, this is an information 1, information 2, information 3, information 4. So these are the information. You don't have to be thinking about any other information. If you are thinking about any other thing and you are bringing it to the question, which you did not do, I love that, because most students, they tend to bring information to the question, maybe information that never exists in the first place. They don't think about the only information in the question. They bring information which is bad because it causes you to overthink, right? You need to focus on the information NCLEX has given you. These are the information, so you can pretty much answer this question with the given information. You don't need to start adding information or extra information to the question. That is what chronic overthinkers always used to do. Now, since I have the information right now, so I now need to ask myself, am I including this information to the teaching? 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 This is what I am thinking about, right? So one is this: many students, when they want to study for pharmacology, right, they struggle with pharmacology. Why? Because they don't understand the basic. Now, the moment you understand the basic of pharmacology, everything is going to fall in place. Pharmacology is not difficult. It might be difficult in nursing school, but not on the NCLEX exam. In a sense that pharmacology in nursing school try to test you on a whole lot of things, but pharmacology on the NCLEX exam is only testing you related to nursing care. So there are a lot of things that you will not be tested on. Most especially, pharmacology want to focus on what? The basic aspect of nursing, trying to keep a patient safe, right? It's not testing you like every medication you've been working for like 2-3 years. No, it's testing you like a new nurse that just have 12 months experience, most especially an entry what level nurse knowledge, the expected knowledge for an entry level nurse. Now, what are the expected knowledge uh of an entry level nurse? You should be able to know what to do before you give a medication and know what to do after giving a medication, right? What are those special teaching related to medication? Now, NCLEX is more big on the class of medication than the medication itself. Now, when you know the classes of medication, you have a bigger picture of what NCLEX can test. That is one. Because even if you don't know the specific medication that the NCLEX is testing you on, right, the knowledge you have related to each class of this medication will reflect in the answers. The knowledge you have related to the class of medication will reflect in the answers, right? So when you understand like a class of medication, like now, this medication, right? Um, the class of this medication is what? Antiplatelet. Now, since I know this is antiplatelet, I might not know this medication, but I know antiplatelet. Now, if I'm thinking through different medication, now I can easily cut down every class of medication I know. Like now, if my first option is saying notify the primary healthcare provider if you experience unusual bruising. Now, this is a pharmacology question. So I will start thinking, which class of medication can cause unusual bruising? I've learned this earlier on. So I'm going to now start saying, okay, this. I'll think about it. I might say, okay, all right. Antiplatelet can cause that. Anticoagulant can cause that. So my thinking right here would be, is this medication related to antiplatelet or anticoagulant? Now, I'm also going to look at option 2. I'm going to also say, OTC medication containing, is there any medication that we should not give alongside with acetaminophen? I'm going to ask myself that. If there's any, I will think about it. If there's none, I'll also like think about it. That's how I'm going to go through this answer. Now I'm going to ask myself, what kind of class of medication can make a nurse teach a client to avoid driving? That's what I'm going to be thinking. So I'm going to be scanning through all the class of medication in my head, and I'm like, okay, this is the class, this is the class, and I'm going to ask myself, is it related to this class? Right. Then I'm going to also, once I'm done with the scanning, I'm going to also go through number 4 again. I'm going to say, is there any medication that when we are trying to do checkup related to the medication and blood specimen, we do serum albumin? I'm going to ask myself that if it's related as well too. That is how I'm going to walk myself through the question. But now, the best approach in navigating the NCLEX, one, you need to understand your class of medication, because this is what I did, right? I have a triangle right here. I have the class, I have the use, and I have the MOA. Right. So what I did was to learn 30 class of medication. Right. NCLEX don't test you related to brand name. At least they test you related to the real name of the medication, which is the generic name. Right. So NCLEX test generic name. NCLEX don't test brand name. So when you are reading you are studying 30 classes of medication, you want to know the main use one that an entry level nurse need to know, right? Because there might be other ones, but the main one entry level nurse need to know, and it must be the generic name. That way, before you study, at the end of studying all the 30 classes of medication, you will find out that you now know every medication, right, that the NCLEX
Mhm.
can test. You now know what every medication that the NCLEX can test, right? So you will not go on the NCLEX exam and be lost, right? Because when you see a particular medication, you already know. If you are not knowing the medication, guess what? The class of medication we help you out. That's the reason why most times you need somebody that understand the exam that can really help you break it out, because you have done the whole job by learning the classes. So even when you don't even know the medication, the class should be able to save you. But how do you use the class of the medication to answer the question? That's the big idea that most students is missing. Most students feel is until they know the medication, that is when they can answer the question. Sometimes it's not like that, because there's one thing: if you know the medication, you'll be able to navigate the question. But if you don't know the medication, you can break each of these things to what the NCLEX is testing, and also to how it fall under each classes. Because that's what I did for the first 7 days. I was just learning classes they use the MWay, classes they use the MWay, and I was learning the safety concern. I was learning everything related to what the examiner is testing. Now let's even break this answer is related to what the examiner wants to test, because on the test plan, NCLEX has listed what they want to test. So you now need to now understand what is the examiner testing here, what is the examiner testing here, what is the examiner testing here, what is the examiner testing here. Right. So because now this is what I did. I was not just reading the class of medication, the use, the MOA, the no. I was also reading it related to what the examiner want to test. Now, the NCLEX examiner is testing here. What the NCLEX examiner is testing here is side effect versus adverse effect. That's what the examiner is testing here. What the examiner is testing here is over-the-counter medication that you can use and the one you cannot use. Right. So the first one, as I said, the examiner is trying to test your knowledge related to what? Side effect and what? Adverse effects.
Yes.
Number two, the NCLEX is trying to test your knowledge related to OTC medication that you can use and OTC medication that you cannot use alongside with other medication. Now, yeah, the NCLEX is trying to test your ability to recognize response to what? Medication. And here the NCLEX is trying to test, what we call this is follow-up or checkup. That's what we call it. Follow up or checkup. That is what the examiner is trying to test here. So now, everything you are thinking right here, you need to be able to understand at least basic knowledge, either related to the medication or related to the basic foundation of what? Pharmacology. Now, basic foundation related to pharmacology states that we don't prioritize side effects, we only prioritize what? Adverse effects.
Advert.
That's one. Side effect is expected. We only tell the patient about it so that when they start experiencing it, they just understand that, okay, it's a side effect. It's not concerning. It can be discomforting, but it's not a problem, right? But adverse effect is life threatening, and that's what we need to report to the doctor. So now, when I come on the NCLEX exam and I'm seeing my question related to pharmacology, and the question is telling me notify your healthcare provider if you experience so and so. I don't care about what the patient is experiencing. The fact that the question is stating that you should notify the healthcare provider automatically speaks what? Adverse effect.
Advert.
And there's the number one biggest aspect of safety related to pharmacology is reporting and follow up or checkup. This is the number one biggest safety related to pharmacology. These are the answers that when you see on your pharmacology question, you need to select it. Now, if I'm to select answer in this question, even without not knowing anything, as a novice, my answer based on this rule, my answer will be
Mhm.
either 1 or 4. Because these are the biggest aspect of safety in pharmacology. But the reason why I might not be able to navigate my answer clearly is because as a novice, I might not know whether this is correct or whether this is correct, because this fall under checkup, this fall under reporting, right? I might not know because I know one will be correct, right? But we are going to come to that pretty much soon. But that's the basic. So now if I see answers like that related to checkup, reporting, they are your answer. I don't need to start thinking about this. It's the basic foundation of pharmacology, right?
Okay.
Anytime you see on your answer key, and your answer key is like report to the healthcare provider, notify the healthcare provider about anything, you don't care about this. It's a rule already. You don't care about this. This is not your concern. The key thing you care about is that this is it. This is what the examiner is saying. So this would definitely always be your answer in any pharmacology question, right? Because it speaks about this as what? Adverse effect. So now I know the examiner will not test me on side effect and tell me to notify the healthcare provider, because the NCLEX writer, they understand very well that we don't report or notify healthcare provider about side effects. We only notify the healthcare provider about what? Adverse effects. Am I making sense?
Yes.
All right. So great. So I know this is testing me on what? Adverse effect. And based on my what? Basic knowledge related to pharmacology, I know that will definitely be my answer, but I will not just go into that immediately. I'm still going to go through other answer keys. Now, second answer key is testing me on what? Over the counter. Now, before you go on the NCLEX exam, you need to know some medication that you can use with what? With other medication, and some medication that you cannot use. Now, with your knowledge with acetaminophen, this is a medication that is safe. Matter of fact, this medication is the best medication in the world. This medication is not contraindicated to any other medication. It is safe to use. So when the NCLEX is saying we should avoid it, I'm like, why should we avoid a safe medication? It's safe. It's no problem. So since it's not a problem, right, I'm going to X this out. Right? Because it's no problem. So now that's out. Right? The ability to answer this question is not because of maybe I know about the medication, it's because I know acetaminophen is safe. Right? I know we can use it with any medication. If NCLEX changes medication and they still use acetaminophen, it's still going to be safe. You understand? So now we don't avoid it. All right. So now the third one is testing your ability to understand response. Now, response, when you want to understand response, response is related to three things. Response is related to the use of the medication. Response is related to the side effect, and response is related to the adverse effect. Right. So now, when the question is talking about this particular response, right, we can say, oh, that is related to side effect. Now, because it's not related to the use, because it's talking about avoid driving your car. So there's a reason behind that. They say avoid driving your car related to what? The medication, in a sense that maybe the medication can cause the patient to be drowsy, dizzy, heavily sedated, or something like that. Right. Now, those three um symptom that I mentioned, or what the patient might be experiencing, they are not related to adverse effect. A patient is drowsy, dizzy, sedated, they are not related to adverse effect. They are side effect of medication. The only time that we can start saying, oh, maybe they are adverse effect is if um it's a medication that have started what affecting their respiratory rate. So, but if the question is not talking about respiratory rate being depressed or decreased, then we can easily just say they are just side effects, right? They are side effects, expected side effect from various medication, right? Most especially medication that we use related to what? The CNS, central nervous system, right? So now looking at, if you follow your studying routine, in a sense that you study the classes of medication, you study the type of medication commonly used in those classes, right? You would have learned this particular medication because it's very common, and you would have noticed that, oh, this is antiplatelet medication. Medication that can cause drowsiness are your CNS medication, and as well to medication related to cardiovascular that can cause dizziness and all that kind of stuff. And one thing I want you to know is that we don't even tell patients that is taking cardiovascular medication to avoid driving. It's more, this teaching is more related to patients that are taking medication that can affect what? The CNS, right? So medications such as your diazepam, such as your seizure medication, right? Another medication like opioid, morphine that can cause all this. That's those kind of medication we tell them. So this medication is not falling into that category at all. It's not falling to that category at all. So since it's not falling into that category at all, then this is not a good, correct response what to the medication. So that is out. Now look at the last one. It's saying you should check your blood specimen obtained. Yeah, we want to like have a blood specimen obtained for checkup related to most medication, but the common the ones that are related to blood specimen checkup or something like that are your CBC, liver, kidney, right? So the liver is your AST, ALT, kidney is your creatinine and bone, right? We don't do serum albumin. Serum albumin is not related to medication. Serum albumin is not related to medication. If this is what the NCLEX is testing, then fine, right? But serum albumin is not related to any medication checkup. We don't do that. So since I know we don't do serum albumin, we focus on just these three things. Now for this medication, right, we are going to check the platelet. And if we are going to check the platelet, which kind of test are we going to do? Obviously CBC, because that's where you can see what the platelet
Platelet.
count. Right. So, but if we don't do serum albumin, these are just the three kind of uh blood specimen. These are the three kind of check we check when we are trying to what obtain what blood specimen, not serum albumin. Related to medication, serum albumin is not part of it. Right. So it's either CBC, is either liver analysis, is either the kidney, right, but not serum albumin. So that is the main reason why this is wrong, right? You don't necessarily need to now know, oh, what are the necessary checkup? You just need to know which ones, you just need to be able to understand that, oh, this is not part, right? You just need to understand that, and you are able to answer the question successfully. Now, the ability to answer this question is one, understanding the class, two, understanding the medication, three, understanding how to break the question related to the mindset of the examiner. Every answer screams something that the examiner is trying to test. The moment you understand what the examiner is trying to test, you can be able to break the question accordingly. That is the reason why plus content plus knowledge equal success. The moment you have the content and then you create knowledge related to that content, trust me, you are going to succeed. Because if you go on the NCLEX test plan, right, the NCLEX test plan only have the content listed. Right, if you check the test plan, right, you are just going to see the content. Nothing is explained, just the content, what the examiner will test. But if you get a platform that can explain this content to you, then now you now have knowledge related to the content. So content plus knowledge equals what? Success. So now the next thing you just need to now start understanding is how to break down the question, because that is the next stage. Because now you have the content and you have the knowledge. Now you have the ability to succeed. So now what you now need now is now to break the question, because in nursing school you can easily just navigate to the question. But on the NCLEX, the whole goal of the NCLEX make navigation of the NCLEX question different. In nursing school, you just break the question, you go to the answer straight. But on the NCLEX is trying to test your ability to practice, and NCLEX is trying to test to see if you are a safe nurse. So how will they see if you are a safe nurse? You are not going to be a safe nurse if you are telling a patient to avoid acetaminophen. You are not going to be a safe nurse if you don't understand the response to clopidogrel. Right? You will not be a safe nurse if you don't know the right checkup for the medication. Right? So You will not also be a safe nurse if you cannot identify that a patient need to report adverse effect to the doctor. But how do you know that that is what NCLEX is trying to test? By understanding it. Number one is testing you related to adverse effect. Number two is testing you related to medication to avoid, over-the-counter medication to avoid. Number three is testing you related to response. And number four is testing you related to follow-up and check-up. So these are things that one will learn. If I was to retake the NCLEX exam again, what I would have been doing is, what are the adverse effects related to all this class of medication? I will learn it. What are the adverse effects related, what are the OTC medication that are safe to use generally? I'm not going to bother myself with those ones that are not safe. I'm going to bother myself with those ones that are safe, because the ones that are not safe might be a lot to learn. But guess what? If I know the ones that are safe, all I just need to do is to read my question, and I'm going to find out, is this medication related to the ones that are safe? If it is related to the ones that are safe, then I'm good. But if it's not related to the ones I know they are safe, then automatically I can easily believe they are the ones that are not safe. So if the NCLEX is telling me to avoid those ones that are not safe, even when I don't know them, all I just need to find out that it's not related to the ones that are safe, and I will believe they are not safe. Simple as that. Reading don't come with stress. This is how you study smart and not harder. Because most of them will say, oh, I don't want to study harder, I want to study smart. But are you reflecting that in your studying? You don't want to study harder, you want to study smart, and you have 5 pages of Guillain-Barré syndrome. What's that? You want to only just study for Guillain-Barré syndrome, and you have 5 pages of information related to Guillain-Barré syndrome. That is not a smart way to study. What is the NCLEX trying to tell you about Guillain-Barré syndrome? The pathophysiology, the body system affected, the relevant intervention, and safety concern. That is all. That is all. That should just be 1 page, and you move on. But you see people having 5 pages. What are you learning? Because most people don't understand how to study, and that's the main reason why you need someone that can walk you through the process in a way that it is clear, in a way you don't feel overwhelmed, in a way that you are getting the information without having difficulty. That way you start preparing in a way that you can easily pass the exam successfully. Right, a minimum question without no stress. Right. So also there are some special instruction we give to patients when they take medication. So what are those special instruction we give to patients when they take medication? That is what you want to take note of. What are side effects that are not concerning? What are adverse effects that you should know? The moment you know side effects that are not concerning, any other things are adverse effects. Right. What are your checkup? All these things. Then you create an understanding. There are more. Right. There are also some uh there are also principles that are related to when you should use certain medication, either in the morning, either in the evening. Right, there are principles like that. There are also principles that also recommend you to give certain kind of maybe diet, right, alongside with the medication, right? So there are certain things like that that you also need to know. But if you want to get into understanding how NCLEX write the question, you are definitely going to what succeed. Any question?
So far, good. No question.
All right.